Soon to be PTE is an audio education series dedicated to helping physical therapy students prepare to take the National Physical Therapy exam. Audio content will be grouped into sections such as musculoskeletal, neuromuscular, cardiopulmonary, modalities, other systems, and so on. And in each section, there will be subsections of each of the categories. Audio will last approximately 30 minutes and will be a great way to utilize time while driving, working out, or just a break from traditional studying. We will use acronyms, give study hints, ask questions, and pause and give you time to reflect and think of your own answer. But keep in mind, solely listening to recordings will not guarantee you to pass the test. This is only to bolster your understandings, utilize your time, and give yourself a good review so you can walk into the testing center prepared and confident for the test.
That was a mouthful. You got it, man.
Thanks.
All right, so my name is Christian Johnson. I'll be one of the narrators for this audio education series. Currently, I'm a physical therapist in an inpatient rehabilitation hospital. I graduated this last year in May of 2017 from UNLV PT. So I took the board exam this last April just to give a background of what I do and where I came from.
Hi, my name is Skylar Sudweeks. I am an outpatient physical therapist. Just a little background on me. I as well graduated with Christian from University of Nevada, Las Vegas. Whoop whoop. And we took the board exam actually at the same time in April before we graduated in May. And our hopes for developing this soon-to-be PT audio education series is to help prepare you guys to take the board exam, to feel more confident and prepared, and to be able to utilize your time efficiently when you're driving around to clinicals, because that happened to us quite a bit. I was forced to go places where I had to drive at least 30 minutes. Heck, I had to drive 4 hours to go to Utah.
Yeah, no kidding.
For a while, and so it would be really nice to be able to listen to something and use that drive time as study time, so that way you can spend time with your family when you finally get home.
Just as a different learning tool too. I think listening to something is different than reading, and I think it's just it was a good tool for me I used when I was studying for the exam.
Yeah, so we hope you find this useful, and please share with your friends if you like it. And let's go ahead and get started. So our first question today, we want to talk about ways to help prepare yourself for the physical therapy exam and what we did. And so our first question is, when should you take the test? What do you think, Christian?
For me, it kind of depends on your situation. For us, we had two kind of main options. We graduated in May, so we could take it in April or we could take it in July. Now, the question for a lot of you maybe is, okay, do I take it earlier or do I take it later? For me, it was, and everyone I talked to actually, it was more of the sooner option. A lot of people thought, if I study for months, I'd be more prepared. And I do think that it takes a lot of study, but we had 3 weeks to study and cram for this exam, and we studied beforehand too, but those 3 weeks, we hit it hard, we treated it like a job and studied. So I took the test, gave myself a month or so time, and then I took the test. I don't know if that's similar to what you feel, Skylar.
Yeah, I mean, we really love that answer of it depends, right? I got that quite a bit in checkoffs in school, and I find myself saying that to my patients as well. But it really is true. For me, I was able to start studying during my last rotation. So in April, I took the exam in April, and I started after Christmas break. My New Year's resolution was to start studying for the test, and it worked out. I started taking a test and figured out my weak areas and planned accordingly. And luckily, we did have 3.5 weeks after our last rotation, and I really did treated it like a job and put in some good study times. And I felt almost over-prepared and just sick of reading things towards the end of that 3.5 weeks. But
long story short, I think you give yourself enough time to study, but not so much time that you're overburdening yourself or taking up too much time.
Right. I mean, the big thing that's going to help you the most prepare for the test, and I guess gauge on when you should take it, is how many practice tests you can take. Taking those practice tests is going to prepare you the most for the real exam, and you figure out what areas you're weak in. and you don't know what you don't know, and the only way you can figure out what you don't know is by testing yourself. And so I took 6 practice tests in total before my actual exam. 4 of them were practice tests from Score Builders and O'Sullivan's, and then the PEAT were the other 2 that I took. And those were definitely the most helpful and gave me a really good picture of how prepared I was. And I actually did so well in one of the PEATs that it was like a week before the test and I just wanted to quit, which was probably kind of bad.
Right.
It was the truth.
I think if I were to go back and do it again, when do I take the test? I take an initial board exam, like Skylar said, practice test, and gauge how I did. If I feel like I need to study a lot and maybe do a little study and take another one. If you feel like you're on track to do well in the next, give yourself a month, and you could probably take it sooner than later.
Right. So, what textbooks are the best to buy? I'll start with this one. So, going through looking actually at what the Federation State Board of Physical Therapy recommends, they actually say read all your books that you got from physical therapy school. So Brotzman, Goodman, McGee, they want you to read all of those foundational books. And
nobody got time for that.
You don't got time for that. Hopefully you took some time to really pay attention in class, that stuff actually still sticks in your head, and that you applied it during your clinical rotations so that you have a good foundation to work from. And then you can buy some of the test prep books like Score Builders and O'Sullivan's. And for me personally, I bought both books, and I heard that Score Builders was easier to read, and after reading it, it's a lot easier to read than O'Sullivan's. And so when I was confused on subjects, I went to Score Builders, or confused on not subjects, but different concepts. I would go to Score Builders and read up on the material, and then if I needed further depth on what I needed to know, I would go to O'Sullivan. And they also have their pros and cons too about the tests. What did you think about the Score Builders test compared to the O'Sullivan's test?
I did it the wrong way. I just bought a Score Builders test, and I took it from 2 different editions, and so I got a really good picture of that. And so I actually only did the Score Builders, and I think it was just because I was being cheap. I didn't really take an O'Sullivan's test ever. I don't know if you knew that, but I just always took the Score Builders one.
I think I remember that.
And so I would say get both exams because it gives you a different flavor of these board exam questions. But I did feel like I took a lot of Score Builders exams, and I felt it gave me a good prep. But I would recommend getting both, even if you get an old version that you could take a test from. Of course, none of the companies are going to recommend you do that. But if you get old exams, it's just as good as long as you have the answers. So I would probably get both, just the O'Sullivan's and the Score Builders, but I couldn't tell you what the exams were like, just the Score Builders ones.
That's right. Yeah, so don't be cheap like Christian.
Basically.
Just buy both of them, and then sell one of them back on half.com if you really need to.
Dude, half.com went out of business.
Oh, that's
so much for that.
Never mind.
Amazon, eBay.
Amazon and eBay.
Your underclassmates, stuff like that.
Underclassmates work as well.
So our next question that we wanted to go over is, how should I study for this exam? You got this big exam, and maybe you have a different approach than I did, Skylar, but you got this big exam to prep for, and you've got these big books. They're fat books, right? So what do I do? Personally, I started by taking a practice exam from the get-go. I don't know, is that what you did?
That's exactly what I did too.
So I even before, I'm like, man, I don't remember anything from neuro. But I just went and did a practice exam. And so then what I did was I saw, okay, what are my strengths? What are my weaknesses? And so from that point, then I went over and went through those sections in the Score Builders book. I only had Score Builders in the Score Builders book. Went through and read that page by page. The ones I felt like I did the worst.
Yep, I did something similar. I took my first test. Probably we'd been out of school for like 8 months, and so I decided to take a test, see what areas I was weak in, and I was weak in cardiopulmonary and neuromuscular.
Yeah, same.
Yeah,
as most people probably are. At least our school.
Yeah, and then there were some things on the test too that I was like, oh my gosh, I know what this is, but I just couldn't pinpoint what exactly it was because I hadn't opened a textbook or done really anything because I was on a clinical. Well, I shouldn't say that. I definitely did study on my clinicals, but it wasn't so detailed oriented. It was function related and getting people back walking and up and out of the hospital. Or, you guys are in similar situations. But so you take your breakdown of what sections you're not the greatest in, and then compare it to what you're going to actually get on the NPTE, the National Physical Therapy exam. And just to give you guys a little breakdown of what the big categories are, is those should be on this 2018 test. The biggest one is musculoskeletal system, with around 61 questions on the test. The next in line is the neuromuscular section, which will have about 50 questions on the test. And then next in line is cardiopulmonary and lymphatic systems, which have around 33 questions. And so those are the big three, and maybe when you hear us refer to the big three in our podcast, that will audio education series. That's what we're really trying to talk about. And then looking down the line, if you scored really low in things like modalities or safety or other systems, you're really not going to get that many questions on that. So you kind of have to pick your battle. Should I really study hard in other systems when I'm only going to get 30 questions, or should I really hit home musculoskeletal and neuromuscular and hit that out of the park? And that's kind of what I did. Is I did really poor in neuromuscular, and that's the second biggest section we're going to get tested on. So I really focused on that section for a good month and made sure that those concepts were stuck in my head.
And one thing I want to bring up too is, I don't know if you feel this way, but I actually don't recommend reading the whole entire textbook from cover to cover.
I remember seeing somebody in the library reading the entire and highlighting like every single page. And
I think people do. And you got these two big textbooks. Which one do I read? And it's so big. I don't recommend that. No. Just because I think it's too much time, and what are you really getting from that? And so I think this approach of, okay, here's what I lack, and then maybe the main big ones you lack, and then you maybe read the whole section of that, take some really detailed notes, and then I think you do what we're going to go into next, and what to do with these practice exams. I don't know if you feel that way, but I think it's just a waste, or it can be a waste of such little time that you have.
And you only have so much brain power if you're highlighting and reading every single line from O'Sullivan's book. If you've looked at that book right now, it's difficult to read. Right. And it's in bullet point format. It's not even in paragraphs. It's like bullet points. And so to highlight everything and think you're going to remember it all, I think is pretty naive,
Yeah.
And you should really focus on the big picture.
Right. And big picture, I think, is you need to be well-rounded. The board exam makes you're not going to be a specialist in musculoskeletal on the board exam necessarily. You're going to have to be well-rounded in all of musculoskeletal, well-rounded in all of cardiopulmonary. And so that way, when you get exposure to this question, you have an idea. Instead of I'm going to memorize this minute detail, you get well-rounded in these systems and then start going from there, I believe.
Because the chances of you getting tested on that minute detail are slim to none.
And then you're remembering them.
Yeah, that's true.
So I think that's how you study for these exams too. We're going to go at the end of the listening thing here that we're going to go into
audio education
my
series.
bad. We're going to go into a question and how I studied for the exam and how I think studying for these practice exams will be. So we'll go over that in just a minute, and I think that's, in my opinion, one of the best ways. And you don't get burnt out on studying cardiopulmonary for days either. So
yeah. So, just real quick, I know some people always stress out about scores on practice tests and on the PEAT and all this stuff. I've seen that on different Facebook pages from people that are practicing for the board exam, which are actually really helpful if you're not a part of one of those Facebook groups. I think they can be helpful at times and bounce ideas off of other people, so join one if you're not in. But what are typical scores, if I can speak? Score builders, I thought were easier tests. And if I remember right, my first one I scored in the low 60s, and I didn't do that good at all. But it's my first test in a while. And
I think I got high 50s. So.
Oh, balling.
I know, balling.
That's pretty good. And so don't get alarmed when you score that poorly on a test, because I know all of us would freak out and think we were going to fail a program if we did that bad in school on a test. But take what you can from that and figure out the sections that you're weak in and improve from there. And my scores steadily went up, and I think I was in the 70s on score builders and O'Sullivan's, and then the PEAT will give you the biggest gauge of how well you're ready for the test.
Right. Which I did the PEAT right before. I felt like I was getting, okay, I feel pretty comfortable with these. I did it not right before, but soon before the board exam. I was like, okay, because that's the one that's most like the board exam, correct?
Yeah.
And so that way I was like, okay, here's how I'm going to do. And like, oh, I really need to focus on neuromuscular now because this is what the board exam is going to be like. So.
Yep. I mean, so for those of you who don't know what the PEAT is, I actually don't know what it stands for. But
personal education audio technique.
Perfect.
Just kidding. I have no idea.
Christian just made that up, but it is a test that you can buy from the FSBPT, the people who are the ones in charge of the national board exam.
Yeah.
And so you buy the test. It's like $100 for 2 tests. One of them's a retired test. The other one's just a practice test with a bunch of questions. And so what I did was I did the practice test a month before my actual exam.
Yep.
And then I did the retired test, since I thought that was the most like the real thing, since it was an old test, a week before the actual exam. And so that way, if I did really bad on that one the week before the exam, I knew what to study, and fortunately, I did really, really well.
Right.
Almost.
I would 100%, if you get one thing from what we talked about today, buy the PEAT. Because I think there's high correlation, and they even want to tell you on their thing, if there's a high correlation between how you do on that and how you do on the actual board exam. There was like we were looking into studies about it, there's like high correlation. Like if this is how well you're going to do here, this is how well you're going to do on the board exam. And
we were looking into it so much that we wanted to just stop studying.
Yeah, exactly.
But,
I did so good on the PEAT. I'm done.
I'm done. But we didn't, don't worry. We spent way too much time and money to stop studying to make sure that we were prepared for that test. So.
Yep. Just as an overview, real fast before we go into our question that we have, we kind of talked about a lot of things today. Let's just go really fast. So when should you take the test? It kind of depends on what you think is best for you. Put an adequate time, but don't think that you're going to spend months and months after to try to study for it. Take time, but don't go way too into it.
What textbooks are the best to buy? Really, all of them. But if I was going to, I'd buy both O'Sullivan and Score Builders. Read from Score Builders and then reference O'Sullivan to get further depth of knowledge.
Okay, next, how should I study? I think the practice exam method, going at the very beginning, taking a practice exam, seeing where you're weak, and then using those practice exams to study is the best way, in my opinion.
100%. And then typical scores, don't always try and compare yourself to others, and we often try and do that. But if you're scoring in the 60s and then you can get into the 70s before the test on either the Score Builders or O'Sullivan's, you're going to be fine. But best advice is to just take the PEAT. That's going to give you a clear picture of where you're at.
Okay, so today our goal was to just kind of give you some tips that we found by just taking the test earlier this year and going through that horrific process. And then we kind of wanted to go through a question and how I felt it was best to study. This is the best thing for me because I could take a question that seems simple and really turn it into a study tool. And this question so I'm going to show you that what I did, and I think Skylar did something similar. And we took a question from the FSBPT's website. It's a sample question, which I think is okay to use. So I'm going to read the question to you. It states, a patient has used crutches with a partial weight-bearing toe-touch gait for the past 3 months. When progressed to full weight-bearing, the patient is unable to demonstrate a heel-toe gait sequence with the involved extremity. Which of the following disorders is the most likely origin of the gait abnormality?
Okay, that was a handful. An earful.
Yeah.
For those of you listening, let me read this again, and you can think about the question as I read it again. So there's a patient who has used crutches with a partial weight-bearing toe-touch gait for the past 3 months. They are then progressed to weight-bearing, and the patient is unable to demonstrate a heel-to-toe gait sequence for the involved extremity. Which of the following disorders listed below is most likely the origin of the gait abnormality?
So the gait is they can't do a heel-to-toe gait sequence. So A is plantar fasciitis.
B is fibular or peroneal nerve palsy.
C is heel cord tightness.
And D is hammer toe. So A, plantar fasciitis. What is plantar fasciitis? Well, it's inflammation of the plantar fascia.
The key with plantar fasciitis as far as gait goes is how is a person going to demonstrate with plantar fasciitis? It's going to be painful on the bottom of the foot, but it's also going to be after a period of rest. So they're going to incur pain after rest. So first thing in the morning, sitting at their desk for a long time, they get up, boom, they have pain. So it's not going to really have a gait abnormality per se, but they're going to complain of pain as soon as they get up. So it doesn't really fit into this scenario. Does it keep them from doing heel-toe? Maybe, I guess, if they have a lot of pain, but no, not really, especially in this scenario, toe touch to full weight bearing. So
yeah,
we can cross off.
It says nothing of antalgic gait pattern.
Yeah.
So
okay.
Plantar fasciitis, not likely.
Right. And just a kind of a side note, this is how I would study. So I would take these things, why is it this and why is it not this? And then I keep studying about it. One thing that you can do as a therapist, special test for plantar fasciitis. Okay, well, how do I figure out it's plantar fasciitis, this whole pain at rest thing, and then what special test can I do? So one is called the windlass test. Essentially what you do with a windlass test is you dorsiflex, or I guess extend the first toe, the hallux, and so then they'll experience pain upon the insertion, like Skylar talked about earlier, along the calcaneal tuberosity of the heel. Oftentimes I've seen the windlass test where they'll stand on a step or a stool, and then they'll do the same thing. Their first metatarsal is just hanging off the edge of the stool, and then they'll extend it. How I memorize this windlass test, random name for this test. Well, I found out when I was studying that a windlass is those little cranks you see on top of a well. So if you picture a well, they've got these little things built on them, and then there's a cylinder with a rope wrapped around it, and then it goes to the bucket, if that makes sense. So then you crank this thing, and the bucket and the rope goes around the crank, and then the bucket goes up and down. Do you know that, Skylar?
So you're saying that the cylinder then, that the rope wraps around, that's the windlass?
That's the windlass. Mm. And so then I use that okay, well, your toe is this cylinder that's attached to this rope, per se, which goes to your calcaneal tuberosity. And so you're pulling on that crank, and it pulls your plantar fasciitis tight, and the bucket then causes pain. I know it's kind of random, but I was like, what's a windlass? And so that pulling that cylinder, which is your toe, just helped me memorize, okay, this is a test for plantar fasciitis.
You're always Googling stuff.
Yeah, pretty much random crap, just to try to get me to remember this.
Hey, you do what you got to do that works, and that's hopefully will help that stick for some of the people listening to this. So the next question was going back to it, the next
distractor.
Distractor is The stem is the question. The distractors are the answers. Is what one of our professors used to teach us. So another choice you could pick is fibular or peroneal nerve palsy, and so another name. Side note that this could be called is Zenker's paralysis. I
got no way to memorize that one, but I've never heard of that until I was reading for this. But.
You probably find that in O'Sullivan or something.
Yeah.
They'd have some little minute detail. You're probably not going to get asked that on the board exam. They're not going to try and trick you.
There was a few, on the board exam, I remember there was a random thing I'd never heard of.
Really?
But anyway, how are you going to prepare for that?
Yeah. Hopefully they threw it out.
Yeah, maybe. It's one of those test questions, right?
Yeah. But anyways, so peroneal nerve palsy, let's just start with what is the peroneal nerve. So the peroneal nerve starts off from the lumbar plexus to the sciatic nerve, and the sciatic nerve, it splits into the tibial nerve and the peroneal nerve. We're going to follow the peroneal nerve track, so if we kept following the peroneal nerve, it's going to come down and it's going to wrap around what structure? Hopefully you guessed the fibular head.
Yeah.
So it wraps around the fibula, and then it kind of divides and branches again into the deep peroneal and the superficial peroneal. Now, I know we haven't talked about this, but can you think of what is innervated by the superficial peroneal nerve? It is the lateral muscles of the leg, peroneus brevis and peroneus longus. Can you think of what is innervated by the deep peroneal nerve? The big one is anterior tib. Anterior tib is that big one, which prevents drop foot. Some other muscles that go along with it is extensor hallucis longus, extensor digitorum longus, and peroneus tertius. So knowing these muscle innervations, we learn if we were to have peroneal nerve paralysis, we would also have foot drop. And these muscles are all responsible for dorsiflexion of the foot. And so this person has an abnormal gait pattern. They can't perform a heel-to-toe gait pattern. And they'd have foot slap.
They would have foot slap. It wouldn't be a heel-to-toe problem. They would just go, they would do it heel-to-toe, but they wouldn't be able to control their swing, essentially. But they could do heel-to-toe because they're just going to slap it on the ground, so to speak.
Right.
The other key to this, too, is that they went from partial weight bearing to full weight bearing, and that caused the problem.
Mm-hmm.
And so that's really not the mechanism of this.
Right. That's why I kind of stumble for a second. I'm like, wait, it is heel-toe technically.
Yeah, technically it is.
It is, but when you go back to the root of the question, that it's, like you said, they went from non-weight bearing or toe touch weight bearing to weight bearing. It's not like they had some type of nerve injury. The question never said anything of that.
Right.
So good call.
Next distractor is heel cord tightness. That's the next thing it could be. So heel cord is a fancy word for Achilles tendon, if you didn't know that. And what two muscles make up of the Achilles tendon? Gastrocnemius and the soleus muscles. This one makes sense, and hopefully it made sense to you when we first read the questions too. If you go from a toe touch weight bearing to a full weight bearing, they've been in a plantar flex position for a while. So because of that, they're going to have tight gastroc and soleus. So because of this, they couldn't go to a proper. I think the key to this one is they couldn't properly go into like a strike with the heel. They've been used to striking with the toe a lot, and so their heel would be difficult to get that full stretch when you need to get dorsiflexion because of the heel cord tightness. So that, to me, that one, makes sense.
Mm-hmm. Because they'd want to demonstrate a toe to heel.
Yeah, exactly. Or even
sequence.
Just a toe to toe, or whatever. But yeah, exactly. So the heel part would be difficult. And it makes sense in the progression from the partial to full weight bearing.
Right. The last one is hammer toe. So hammer toe is a deformity of the proximal interphalangeal joint of the second, third, or fourth toe. And it supposedly resembles a hammer. And these are usually caused from wearing tight shoes or having the toes bent for a long period of time.
Yeah, like also in heels. So like women that wear heels a lot, they can get this and get into a tight-filling shoe so that their toes get pinched. But anything they're bent for a long time. And I think, this one actually, at first I was like, hammer toe, yeah, right. But it kind of makes sense, right? Like if someone's wearing heels for a long time, you can kind of see, okay, that's kind of like a partial to full weight bearing. Like you could kind of see where they're going with that, kind of, I think. But again, it's not going to prevent them going from a heel to toe gait pattern, I think, besides maybe pain at the end of the cycle. And also, there's no mention of shoes or heels, or you're not going to be wearing shoes in this situation necessarily.
I think that brings back to a good point of don't assume things, don't put things into the test question that aren't there. It doesn't talk about footwear. It didn't talk about any type of nerve damage like we talk about with the fibular palsy. It doesn't talk about when they have pain or problems with that could be associated with plantar fasciitis. Go with what the question says, that they were toe touch weight bearing. Now they aren't. When people walk in toe touch weight bearing gait, they're most likely going to demonstrate some tightness in their calf and in that heel cord like you talk about. And that makes the most sense.
Right. And to me, one of the reasons I chose this question is that I think for some of you it may have been intuitive. Like, okay, yeah, heel cord tightness is the one I would go to. But this is a good way to kind of analyze these questions. And on the board exam, you're going to have to do this.
In a lot faster time.
They'll have faster time for sure. We took a while, but I think it's a good practice on how to do this to study too. I took this and I would take each response and be like, okay, why is this the answer and why is it not? I took an opportunity to study, okay, what is plantar fasciitis? What do I know about it? And that way also I could kind of jump around the book, and so I wasn't studying for a week straight about cardiopulm. I wasn't studying a week straight for musculoskeletal and just like, man, all these things. I took notes on all these ways, and this was just a way that helped me, but regardless, going through questions like this and saying, why is it this one and why is it not this one, is going to help you to prepare for those board exam questions, I feel.
Yep, and I think like how you studied, how you just did it right here, gives you a good big picture of what things really look like and helps you review. Even just for that question, if you just jump to hill cord tightness right away, well, that's the right answer, but you dived into why wouldn't it be this or that, and that kind of mentality really does help you study everything with just one question.
Right. And this is what we plan to do, not the whole audio series, but I think we plan to go through some questions like this.
I think at the end of each audio section, we'll have at least one, if not two questions to kind of pepper you with and get you to think, this is a question that you'll get based off of what you've learned today and what we've talked about. How would you respond?
Right. And we'll take time to do things like Skylar did, and he paused throughout his thing to give you a chance, like, to kind of test yourself too, like, where does the peroneal nerve go? Okay, yeah, it wraps around the fibular head, all these things. So that was kind of a good maybe sample of what we plan to do too with, like, let's say cardiopulmonary, go through each section as well. So.
Yep. So we hope you guys enjoyed this, and we look forward to making many more audio education recordings for you guys to listen to. And if you like what you hear, please like us on Facebook. We're not on anything else. I was going to say Facebook.
We'll be on
Twitter,
something. We'll be on all the cool stuff. Don't worry.
Oh yeah, we're gonna definitely do it.
We're hip, so.
Yep, we are pretty cool. No, we're on Facebook right now, so like us on Facebook. Check us out on YouTube, and comment below with your email address if you would like to receive updates from soon-to-be PT and special discounts that we plan on doing here in a couple of weeks. Thanks.